The center of our model is the patient. The only way we can make a difference for our employers, our clients, is to truly take better care of the patients. We can talk about technology all day long. We can talk about data-driven healthcare because that is something we provide and it's something we're very good at. But what happens in the room, in the office, between the patient and the provider is where we can make the biggest difference.
On average, I get to spend about 20 to 30 minutes per patient, which for me, that's unheard of. In the past, I've had, maybe 10 minutes per patient. It's kind of like a production line. With CareATC, you have sufficient time to go through the things that you need to address with the patient. I feel like the love for medicine has sort of been reborn when I joined CareATC.
If you don't have your own health, nothing else matters. And that's why I like doing what I'm doing. This is definitely what I was made to do. And yes, just a little extra time. I mean, sometimes we're pretty busy, but we have a little more time than that hospital doctor does.
Now I really feel like I have a smaller base of patients to work with and I have more time to get to know them, and that really helps with what I call motivational interviewing. Whenever I know something about the patient and know what their goals are and what their health issues are, it really helps me to motivate them and for them to identify their motivation for getting better. And I just didn't have time to do that before.
When we're recruiting physicians, they really can't believe that this is the model. And then once they're here, they'll say, this is why I went to medical school. And I think physicians really went to medical school because they want to have time to care for the patient. And our model allows that.
In this model, we're finding colon cancer, we're finding breast cancer in people that had no idea. Recently, I had a guy that had a malignant melanoma, and he's in an age group where he shouldn't have it. And he came in, he's been one of our patients, we got a biopsy sent off, so we're early in the treatment, so there should be a good outcome.
There's a misconception out there today that just because a company has a health plan, that all their employees have a relationship with the primary care physician. And the fact is, the majority of the people out there do not have that relationship with the primary care physician. They don't seek care until the seriousness of the issue outweighs the hassles involved. When that happens, major diseases go unidentified and untreated. So our goal is to engage the employees and their families, change the healthcare culture. Promise is to promote health, prevent disease, and provide a shorter path to care.
You get to have a life and you get to practice medicine. How else? I've never been in a position like that, and it's a true blessing. So that's what I say to my peers, that really it's the perfect situation for a physician who wants to have a life. And I feel fortunate. I feel fortunate to be here.